what E&M code should I use when a new patient comes into the physician office and the doctor documents the 99201 to 99205 codes along with the preventative codes or well visit codes? I believe the 99201 to 205 would be appropriate, even though the physician states he did the well visit too. Okay, so basically it should actually start with the reason for the visit. So did they schedule like a well visit and then a problem was found during that visit? If that's the case, then the preventative visit would be really the main code you'd want to use, and then you'd have to decide if the work was significant enough to warrant a regular E&M. And if it was, then you'd want to do modifier 25. Okay, it's not moving for me, Boyd. If you could scroll on, as Chandra says. Okay, so then in this case, the questioner was specifically mentioning new patient codes. So maybe the patient's not sick, maybe they're coming in to get established as a new patient, they just moved to the area. For me personally, I would still use the preventative visit codes, but you really want to go by how the payers want you to do it. But there's no illness, and in my book, if there's no illness, that's a preventative visit. And if you scroll down a little bit more, I did just a little grab of our coding manuals on preventative medicine. These are just some of the annotations that I've got in there. So for preventative medicine, I write asymptomatic patient, they're not sick. And the guidelines tell us that these codes are based on age and risk, which is normally what you're doing when you're getting established and they're running tests and doing things that would be considered comprehensive in nature for your particular age. So if it's a well baby visit, they're going to be doing all those pediatric kind of tests, talking about immunizations and all that sort of thing. But if you notice the third paragraph down, it says, if an abnormality is encountered or a pre-existing problem is addressed in the process of performing this preventative service, and the problem or abnormality is significant enough, that's key, so I have that highlighted, to require additional work, then it tells you to use the codes from the 99201 to 215 range. So if it's minor, they're saying just bundle it in. Now, and that's if you scroll down a little bit more where I have it underlined, an insignificant or trivial problem shouldn't be reported. So that's how I would kind of go about it. I can't, you know, the questioner was saying that their physician wanted to code both a new office visit and preventative. I don't think that would fly with most payers. My colleagues can chime in if they agree or not, but I feel that that would be a preventative visit. And one recommendation in cases where you do have a preventative visit and you have what I call a problem-based, keep the notes separate, because if you get audited and you have to send in documentation and you've got your preventative medicine visit and you've got your problem visit separately documented, then you'll have a much better chance of both of them getting reimbursed. And I like to say, if you don't have a HEM, history exam, medical decision making, then you can't bill an E&M. So if you don't have something significant enough that it could even be written separately, then you probably should just bundle it in with the preventative medicine code.